Hello, I am Sylvia Azania, and in this video we are going to talk about week 34 of pregnancy. We will discuss the changes in the mother, how the baby is doing, provide some recommendations, and also talk about medical checkups during this week of pregnancy. Additionally, we will answer the most frequently asked questions that users may have related to this topic. As the pregnancy progresses, the volume and weight of the belly increase. The pregnant woman will feel more and more tired and uncomfortable as the expected due date approaches. The woman will have trouble sleeping and resting at night, in addition to noticing pelvic pressure as the baby becomes engaged. Once reaching the 34th week of pregnancy, it is normal for the woman to experience some of the following discomforts: feeling of suffocation, dizziness, gas, slow and heavy digestion, uterine contractions. In addition to all these symptoms, the woman may present a condition called intercostal neuralgia. This is a sharp pain caused by the pressure exerted by the enlarged uterus on the nerves in the rib area. It is recommended to apply heat, as well as to be mindful of posture when sitting and not to remain seated for long periods. And before we continue with the content of this video, I'm going to ask you please, if you are enjoying it, to give it a like and subscribe to the channel if you haven't done so already. It helps us a lot to keep going and to ensure that all the information we publish can reach more people. When pregnancy reaches its 34th week, the pregnant woman should not exert herself or stand for too long. Pregnancy involves a significant physical change. The entire body adapts to this situation, but the cardiovascular and nervous systems may not be able to react properly. For this reason, the woman may experience palpitations or feel dizzy if she makes sudden movements or exerts herself too much. In the final stretch of pregnancy, it is essential to pay attention to the formation of varicose veins in the legs. To prevent their appearance, it is advisable to perform massages throughout the legs and feet to promote blood circulation. Additionally, engaging in exercises such as swimming or taking daily walks can be very beneficial. The fetus at 34 weeks of pregnancy already has the appearance of a newborn. In addition to having a head that is more proportionate to the rest of the body, it shows almost all the features of its little face. Many babies already have chubby cheeks by the 34th week of gestation. Its skin is becoming pinker and is less wrinkled due to the accumulation of fat deposits. It is capable of distinguishing between light and darkness. It also refines its sucking and swallowing reflexes at the same time, which will allow it to feed on breast milk when born, coordinating them with breathing. By the end of this week, the baby measures about 44 centimeters in length and weighs around 2,200 to 2,300 grams on average. On the other hand, the pregnant woman may not feel as many movements from her baby since there is less space in the uterus for it to move. However, when it does move, it will be intense. Additionally, the baby will be descending through the pelvis to prepare for the moment of birth. Some specialists recommend performing the third trimester ultrasound when the 34th week of pregnancy is reached. Thanks to the ultrasound at 34 weeks of pregnancy, it will be possible to assess the baby's growth and the amount of amniotic fluid surrounding it. In addition, the third trimester ultrasound allows for observation of the placenta's condition and its degree of aging, as well as the state of the umbilical cord. And now we are going to answer the most frequently asked questions that users may have regarding this topic. Is it normal to have a lot of amniotic fluid at 34 weeks of pregnancy? By the time you reach 34 weeks of pregnancy, it is usual for the volume of amniotic fluid to have increased. The normal levels of amniotic fluid at this stage of gestation are around 800 milliliters. In contrast, at 40 weeks of pregnancy, for example, there is usually about 600 milliliters of amniotic fluid surrounding the baby. How is placenta detachment treated before the 34th week of pregnancy? If the pregnant woman and the baby are stable, the ideal would be to wait until the 37th to 38th week of gestation to induce labor. Otherwise, if any gestational complications adjacent to placenta detachment are detected, such as fetal growth restriction, preeclampsia, or changes in the woman, then it would be advisable to induce labor. If this situation occurs between the 23rd and 34th week, corticosteroids will be administered to the pregnant woman to help mature the baby's lungs. Additionally, it is recommended that the woman remains on complete rest. We would love to hear about your experience, so I encourage you to share it with us in the comments. I also remind you that if you want more information, you can access the link to the article that I have provided in the tags and in the description.